There we go. We're all familiar with that, right? Recording. So thank you so much. My name is Claudia. I am the chair of the newly merged Tulare Kings Breastfeeding Coalition. And so over the past year or so, we've been working on merging with the Tulare County Breastfeeding Coalition with the Kings County Breastfeeding Coalition. We've been working with these lunch and learns for close to 3 years now. We've been collaborating in different projects as well. So the more that we work together, it just made sense for us to come together and just be one big group. And so over this past year, we've been really working out all the details and working through merging our coalition. So as we became official in June. So in June, these lunch and learns have been going on to close for 3 years. If you are interested in getting any of the past lunch and learn recording, please send a message to us, and we'll be able to share like our email, share an email, and I'll be able to share that PDF. We have all the recording links available for you. So if you're new to our group, thank you. You're in our email list now. So as we continue to do these lunch and learns, you will be getting those invites. But if you're interested in the past ones from the last couple of years, send us an email. But I did want to introduce our coalition members. We have I'm the chair for this year. And we also have Kathy. She's the vice chair, Kathy Porter. Our secretary is Patty Maldonado. Our treasurer is Sarah Smith. And we also have 2 people that oversee like our public media, our Facebook page, and that is Lupe Manzano and Mona Lisa Orduna. Yeah, and if you could see it there, you want a quick access, follow us on Facebook, and you will also be notified there where we get our next lunch and learn coming up in November. So with that, I'm going to pass it over to Sarah, and she's going to give us a little bit of some Zoom 101. Thank you.
Thanks, Claudia. Welcome, everybody. Happy Tuesday. So before we get started, I'm going to give you a quick overview of your Zoom controls so you can have a great Zoom experience. So here's the slideshow showing a little bit of, some highlighted boxes just to take note of if you're not familiar with it. So changing your name on Zoom, just so you know, helps us keep track of our attendees for CE credit, because we run a report and it kind of allows us to see your name. So that's very helpful. Reactions, we love reactions. So use these throughout the presentation to express yourself. And the next slide. There we go. There's the expressions. Okay. So we love hearts, of course, all the hearts. So use these reactions to express yourself and let us know what you're thinking. Q&A is, let's see. Yes, use the chat for Q&A. And then you can raise your hand as well. So there's reactions to raise your hand, you go to reactions, and then there's a little raise your hand icon there that you can use. And then the chat box used to ask this question, ask your questions throughout the presentation. So if you are interested in receiving a CE certificate, by the way, please confirm your attendance to receive an evaluation link to earn credit. So check the chat box for the link or scan the QR code right here with your camera phone, and it will take you directly to the forms. And we will put the form link in the chat. Let me see if I can do that right now. Can I do that? Oh, it's not. We'll do that. Yeah. Okay, so let's proceed and get started with our presentation. So I'm going to do a quick little introduction, and how do I, Claudia, exit? Oh, okay. So Jasmine will be sharing her screen to provide her presentation. So Jasmine, if you want to go ahead and share your screen. And while she's doing that and pulling all of that up, I'll stop our screen. There we go. Okay. So welcome, Jasmine. Thank you for being with us today. Jasmine Pettis Marquez is the Executive Director of the California Breastfeeding Coalition. As the General Manager and Chief Executive Officer of the coalition, she leads the CBC in fulfilling their mission to protect, promote, and support breast, chest, and human milk feeding throughout California. Jasmine is an international board-certified lactation consultant with years of practice in and around the Bay Area, such as Highland Hospital in Oakland, Lemorin, the pediatrics in Lafayette, and within her own private practice in Vacaville. Jasmine is the author and illustrator of Breastfeeding All Around the Bay. That is so cool, by the way, Jasmine. A children's book published in 2020 with the aim of adding a much needed character diversity and breastfeeding to children's literature. She holds a bachelor's degree in health science with an emphasis on community outreach and education from Sacramento State and a master's of public health from San Jose State. Thank you so much for being with us today, Jasmine, and I will hand it over to you. Thank you.
Hello, everyone. Thank you. Am I good to go, Claudia?
You are good to go. The floor is all yours.
Alrighty.
Thank you so much.
Of course. So thank you so much. My name is Jasmine Pettis Marquez. I'm the executive director of the California Breastfeeding Coalition. I want to start off by thanking Tulare King's Breastfeeding Coalition for inviting me to speak today. I wanted to expand a little bit on the introduction that you just heard. I was newly appointed the executive director July 1st, taking over for our esteemed founding executive director, Robbie Gonzalez-Dow, who stepped down in December. So I am the second executive director that the coalition has ever had in the past 12 years. So what does the coalition look like under me moving forward? I wanted to assure everyone that lactation advocacy, celebrating and holding policymakers and the friendly and unfriendly, family-friendly policies that they support is still going to be a cornerstone of what we do. The clinical skill building and education offerings that we have, such as our annual breastfeeding summit, and expanding upon that is something that I want to continue to do as well. And also just getting to know the nearly 54 local and cultural breastfeeding coalitions and task force that we have throughout the entire state. I would love to be able to support and uplift the work that is being done at the community level. So I look forward to getting to know all of you in this new capacity that I have. So if you haven't yet already, please sign up for our newsletter. We'll have links at the end of the presentation to do that, but I look forward to getting to know all of you more. So with that, let's get going. So I have no financial disclosures or conflicts of interest with the presented material in this presentation. I did want to make a note about inclusive language. At the CBC and for myself, we strive to use inclusive language in our communications and in our presentations. However, legislation and policies aren't quite there yet. So in reporting breastfeeding and lactation rights in this presentation, I will often use the same gender terminology that the laws and policies dictate. So our objectives today, by the end of this presentation, I'd love it if you guys would be able to identify at least 2 key differences between California state and federal lactation accommodation. Name resources that clients, patients, and employees can use to file a complaint should they feel that their violations are, if their accommodations are being violated, they're not getting what they deserve. And explain to clients, patients, employers, how to talk to HR or their supervisor about getting their rights. I do want to make a note that I do have several initials after my name, none of which have anything to do with a law degree, okay? But you do not need a law degree. You don't need to be an attorney to understand and advocate for yourself for these rights that we have here in California. So let's set the stage. So before I dive into the actual laws, I think it's important to set the stage and spend a couple minutes talking about why we even need lactation accommodation laws. How many mothers in the United States are working anyway? Well, the Bureau of Labor and Statistics just came out with some stats this April that show that in 2022, nearly 68% of mothers under the age of 6 participated in the labor force. And of that nearly 68%, 80% of them were working full-time. That is a lot of moms in the workforce. And that's me and my 2-week-old son. He was 2 weeks in that picture. He is 2 years old now. And I wound up returning to work at 12 weeks. It was with the CBC, so it wasn't that hard of a sell. He's like our mascot. He's on all the Zoom calls, but let's look at California. So in California, there is 90% of babies start off with initiation. That number drops down to 62% when the baby is 6 months old and drops down to 44% at a year of life, excuse me. So we can say yay California, because if you look at the national data, right, it's 83% initiation, 55% at 6 months, and 36% at 12 months. So nationally, we're doing better. But there's still a lot of work that needs to be done. We can celebrate that we're doing better on the national average, but if 90% of parents want to breastfeed and provide human milk to their babies at the beginning, at the start, then 90% should be able to still be providing breast milk at 6 months and at 12 months. So there's still work that needs to be done. So let's talk through some of the challenges that they may be facing. One of my board members was kind enough to provide me with some case studies and some scenarios. And I wanted to start off with one so that we get thinking a little bit about what some of the challenges, real life challenges that we're hearing from folks. This first scenario has to do with a paramedic. So I know that we have families that don't necessarily work in traditional workspaces. So as I read this, I want you to think of delivery drivers, people who work outside of traditional office spaces and what that may look like. So this is Linda, a paramedic from Sonoma. This is her experience with lactation accommodation. Because I was in an ambulance and completely mobile, it wasn't the easiest to schedule pumping consistently. I either had to pump in the back of the ambulance, which wasn't ideal, or in a bathroom at a hospital. There was some hospitals that would provide a room for me to pump in, but it was inconsistent, so I never asked. Before I wasn't even an official employee of the hospital, I had to make the bathroom work. If I needed to pump after a call, I would complete the patient report in the back of the ambulance while pumping. It wasn't ideal, but it worked. Pumping was always trial and error on an ambulance. I recall a coworker who also pumped and requested that the ambulance be taken out of service every 2 to 3 hours so that she could pump and sterilize her equipment. It was certainly in her right, but it wasn't always well received by coworkers because her ambulance would go out of service. That's a lot of precious time when working on an ambulance. So it felt like I had more pressure from my coworkers not to do so. So what are you hearing there? I'm hearing that there's a lack of support from coworkers. I'm hearing that there was potentially no communication with her supervisor when she was coming back from maternity leave as to where and how she was going to express her milk. I'm also hearing, as a subcontractor with these hospitals, she didn't feel like she could ask them to be accommodated. So what other challenges are we hearing? So parents returning to work, many of them don't even know what their federal and state protections are. And employers, I'll give them the benefit of the doubt, don't know how to create and implement a supportive pumping work expression workplace, right? In California, they are required to have a lactation accommodation policy, but maybe they haven't had an employee who needs it yet, and they need some ideas. And thinking about Tulare, Kings County, what are some of the challenges that you may hear in your area? I know we have people from San Francisco. I saw in Solano, somebody who's here with me. I'm in Vacaville. But what are some of the things that you may be hearing in your area? Are a lot of the clients and patients that you see low-wage workers? They potentially don't work in an office or a building that can just have an extra space to go and pump. Do they even know how it would work to pump at work? Do they even feel like they're covered under these laws since there's so many different eligibility things? Fear of retaliation. We heard just now that this paramedic felt that her coworkers were going to treat her differently or did not support her in taking the ambulance out of rotation. And then breastfeeding parent must return to work, right? This lack of leave time that we have here. So let's go over a few of the federal state laws first. And then we'll keep going to California laws. So there are about 6 laws that I'm going to go over. Title VII, Title IX, the FMLA, Family Medical Leave Act, the Affordable Care Act, Right to Breastfeed Act, and the very brand new shiny Pump Act. So there are 6 federal laws that provide protections for lactation and breastfeeding. Some of these laws will sound familiar as they cover a variety of public health and other health related things, but I'm going to be looking more closely at how they specifically apply to lactation rights. So Title VII. So this law covers employers who have 15 or more employees. It was part of the Civil Rights Act of 1964, and it was amended in 1978 with the Pregnancy Discrimination Act. So this is a job protection or anti-discrimination, law. So it says women affected by pregnancy, childbirth, or related medical conditions shall be treated the same as all employees related purposes. So that's my daughter, and that's me affected by pregnancy. I thought it was funny how they say that, but it covers employers cannot use pregnancy, childbirth, lactation, or need to express as a reason not to hire an applicant. And if an employee requires accommodation for lactation, such as a schedule change or sick leave, the employer has to accommodate that employee just as they would if it was an employee who had to take time off for a doctor's appointment or had some other non-life-threatening medical condition accommodated. Title IX states that no federally funded education program or activity can discriminate against a person based on their sex. So this was also a part of the Civil Rights Act. It was amended in 1972 to include this. This is another anti-discrimination. Title IX became popular. You may hear of it associated with athletes, as female athletes are being treated based on their sex in different universities and schools. So how does this apply to lactation? This law has been interpreted to apply to pregnancy and childbirth and other related conditions such as breastfeeding and lactation because they are related to a person's sex. So Family Medical Leave Act is one that people have heard of. I will go into a little bit more depth on this one when we go over the California law, since California expands upon FMLA and works for greater protections and benefits. But this one is a job protection law. So the federal law says that you get 12 weeks unpaid for certain medical and family reasons. This means that a company is required to hold the job for you. You cannot take FMLA and then they fire you or give your job away to somebody else. It will be waiting for you when you come back. FMLA is unpaid. And in California, there are some programs that potentially would give some compensation if you're eligible. That is our lovely brand new board member, Brenda Vieira. She gave me this picture for this presentation. So the ACA, in 2010, there was the break time for nursing mothers provision added to the ACA. It was very exciting. It was the first nationwide approach to promote breastfeeding in the workplace. It required reasonable break time for lactating employees to express milk in the workplace for up to 1 year after the infant's birth. So the burden of proof is on the employer, to say that it is unreasonable. They have to comply while that decision is being made. So if they say this is undue hardship, we can't handle all of this accommodation, they have to prove it on themselves. It is not on the employee. The provision also requires insurers to provide coverage for certain breastfeeding supplies and support services. So I wanted to take a moment to have a type in the chat, because the federal law, before I get into the California laws, the federal law says that you can express milk for up to 1 year after the child's birth. So what do you think, before I even go over it, what do you think, how long can you pump in California? Type in the chat numbers. How long do you think in California you are allowed to express milk after the infant's birth? Seeing 6 months, 2 years. Any other guesses? There is no language that puts a limit, no limit, 12 months, 1 year. Somebody got it. There is no upper limit. There is no upper limit. In California, it does not say that you have to breastfeed only or express milk and have accommodation for 1 year. It is, as long as you want to express milk for your child, you can, and your employer must accommodate that. So that is something to know. I know for our objectives comparing, that is something that California has much stronger. So there's also the federal law, the Right to Breastfeed Act. So this just protects the right to breastfeed on any federal property. So that can include the post office, bus stops, national parks, and airports, train stations. And then there's the Pump Act. That's my daughter in our little postpartum photo shoot. She's now 5.5 and starting kindergarten next week. So But I digress. So the Pump Act. The Pump Act was passed to close some of the loopholes in the original 2010 ACA law. So again, we were so excited in 2010. We thought that the ACA was going to be this amazing thing that would cover so many lactation accommodations federally. But the ACA law actually left 1 in 4 women of childbearing age without that federal protection. So it was expanded upon, and it expands the careers that were covered and provides resources to address violations. So now, nationally, nearly 9 million more workers, including teachers, registered nurses, farm workers, and many others, have the right to receive pumping breaks in a private space. The Pump Act gives most employees now nationally the same rights that California lactation laws provide. But the federal law gives employees the right to sue their employer for not providing accommodations. That is new. So before the Pump Act, you were not able to go to court and seek monetary reparations should your rights have been violated. So let's talk about that a little bit more. When can you file a lawsuit? A lawsuit can be filed right away under the following circumstances. So for violations of break time requirement, they're not giving you reasonable time. If an employer has indicated that they have no intention of providing you a private space for pumping, they can get sued. If an employee has been fired for requesting break time or space, they can get sued. However, the employee must notify their employer that an adequate space has not been provided. You can't come into work from your maternity leave, look at the space they provided you and say, this is not going to work. Let me sue tomorrow. There has to be a little bit of notice. So here's another type in the chat. How many days, months, years, how much notice do you have to give employers that you are going to sue if they do not comply and accommodate your lactation rights? It is very specific in the law. I'll give you 5 seconds. Type in some time. 30 days, 10 days, 10 days, 90 days. Any other guesses? 2 weeks, 30 days. The answer is 2 weeks. The answer is 10 days. 10 days. So 10 or more days if you want to give them extra time, but they have 10 days to file a lawsuit. Or 10 days to comply. So if you tell them that it's not working out and this is why it's not being followed, the law is not being followed, they have 10 days to comply. But there is a note that you do not have to file a complaint with the Department of Labor before filing a lawsuit. You can give them those 2 days and march right into that courthouse. All right, so wow, I just went over about 6 federal laws in 15 minutes. Jasmine, I didn't know you were a Harvard professor of law, right? I'm not, I have no association with Harvard, but you don't need to be an attorney. It's a lot of words, it's a lot of jargon, but there's some key takeaways from the federal laws that I want you to keep in mind before I go into the California laws. The abbreviations, when they were passed, what year they were passed, who voted on them doesn't really matter as much as remembering the certain things about each law that can get questions going in your mind when you hear them, right? So I'm pretty sure I get at least 1 year federally to express my milk. And I think in California, it may be even a little bit more. So if you know at least 1 year, you can go on and investigate that a little bit further. I'm only given 10 minutes to pump. I don't really think that's reasonable. Or my employer is saying I only have the option of a bathroom. Is that something I have to accept? I'm pretty sure that bathroom and it not being a bathroom is put almost everywhere. I feel like everyone is mad at me or treating me differently because I'm requesting break time to pump. I don't think that's legal. Or to accommodate my new pumping schedule, my boss demoted me and said that if I don't like it, I can quit. There are certain things if you are being told by your WIC participants, by your patients, your clients, that should start ringing a bell where you can have them advocate for themselves and look to pinpoint what law is actually not being accommodated and which law their employer is breaking. So California has the strongest protections for lactation and breastfeeding rights in the country. When a state and federal laws differ, the law with stronger protections must be used over the law with the weaker protections. So the 1 year versus as long as you would like to provide milk for your baby in California is a perfect example of that. Your employer cannot say, hey, the federal law says 1 year, so you get 1 year. We're going with that one. Nope. The stronger law with the greatest protections is California, and that's the law that needs to be followed. So another type in the chat question, I like these. So the laws that I'm about to cover for California, does it matter? Does it involve do these laws cover all Californians? Or do you have to just be a US citizen? What do you think? Does immigration status matter? It's a yes or no question. No, 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 all. That's right. Good. I'm glad you know this. Yes, all. The laws that I'm about to cover everyone, okay? That is a distinction. Oops. All right, there we go. So let's start off with the bullet points for California. I'm breastfeeding my baby and need to express milk at work. What are my rights? So in California, you have the right to a private space, reasonable break time to express milk at work. So again, if somebody is mentioning to you, oh, I'm getting a bathroom, it's not private. Or it has to be close. It's something that's very specifically in the California laws. It has to be close. So say you work at Fresno State or Sac State or San Francisco State, and you have your pumping space is all the way across campus. Is that reasonable? Is that close? And to know what close means, the law does not specifically define what close is, but it does say that the space has to be in walking distance, right? You shouldn't have to call an Uber to get to your pumping space, and it shouldn't significantly extend the employee's break time. Is the area dirty? Does it feel safe? Is there no way to plug in the pump? Or is there no place to store my pumped milk once I have it? So I'll get into that a little bit, especially since I know that we have participants that don't work in offices that have electricity, right? Some are farm workers or work in agriculture. And it needs to be employee provided refrigeration and access to electricity. So we'll go over that when I start going over some resources. So the Family Medical Leave Act for California has the California Family Rights Act, and that applies to employers with 5 or more employees. It does not need to be taken all at once. So here's another thing for that objective. What's something different from California versus the federal? The federal law requires that you take all 12 weeks at the exact same time. For California, it can be taken intermittently. California also has the California Pregnancy Disability Leave. It's completely different. So in California, you can take 12 weeks and 4 weeks of job protection. This is a job protection, but is it paid? Nope. Yeah, USA, right? No, it's not paid. It's just job protection. They can't give away your job. They can't fire you during that time for taking that leave. I did mention that California does have a paid family leave if you're eligible, and it's partial pay for up to 8 weeks who take it off to bond with a new child. And then a quick note about paid family leave. In order to qualify, you have to have been paying into the state disability insurance, which shows up as SDI on pay stubs. So again, wow, that was a lot of information. I'm going to go into California a little bit more, but those are some of the things that you need to know. But it's a lot to remember, Jasmine. How am I supposed to remember that? If only there was a resource or a guide that could provide me that if I was an employer or an employee. Well, do we have something for you? So introducing the California Law Guides brought to you by the CBC. This is, there are employer guides and there are employee guides, and they go over exactly what an employer needs to know to be compliant in the state of California. And then there's a guide that goes over exactly what employees need to know to advocate for themselves, and also other things about maintaining milk supply and things like that. So I'm going to go over both, and we are going to start with the employee guide. These guides, I don't know if you guys have that link that I provided you handy. You can put it into the chat. It's the same one that's at the bottom of these little graphics. We didn't give out the PDFs because we wanted to capture the zip code. So you'll just be asked your email and you'll be asked your zip code. And that's going to help us figure out who is actually utilizing our guides. We want to know if it's just a bunch of, I'm sure there's going to be an uptick in Tulare and Kings County, but if it's just Tulare and Kings County, we want to make sure that we are focusing our communication in Northern California and Southern California too, so that this resource is really reaching folks. So you'll put in your email, it'll go, the links will go to your email address that you provide, and you'll be able to download both guides should you want to access them. So here is our employee guide. This is how it starts. It starts off with some words of encouragement and some basics on how to first and foremost, what lactation accommodation is, and that it is not a bathroom stall. So I specifically shared this screen grab though, because it mentioned San Francisco. I know we have somebody in the audience from San Francisco. San Francisco has their own lactation ordinance, and employers who are in San Francisco need to follow that ordinance. Because it is a little bit stronger in some cases than California. So I think it's important, again, to know that there's federal laws, there's state laws, but there's also local ordinances, and your employer has to follow the one that provides the greatest protections. So if you're not in San Francisco, you have local government officials, and they can and should be doing more. So San Francisco potentially could be a model to replicate or improve upon. But that is something that I wanted to call out. So I wanted to try, the guide also has some frequently asked questions. And I wanted to do a yes or no game to go over some of the questions that we have in the guide. So I'm going to read the question, and then it'll be in yes or no format, and then I'll expand upon that, okay? So get your fingers ready. So are lactation breaks paid? You'll have 5 seconds to answer each one. Yes, no, no, no. No, no, no. Could be sometimes. That's right. It was a bit of a trick question because the answer is possibly, right? In California, you typically don't have to clock in and out for your 15-minute breaks. If that is when you choose to take your pumping breaks, you do not have to use your paid breaks to do that. But say your employer pays you for your breaks, 15-minute breaks, but you take 25 minutes to pump. Technically, your employer does not need to pay you for those last 10 minutes. However, that 25 minutes needs to include the travel time. So that doesn't include travel time to and from the pumping space. And you should not have to be unpaid for the time it takes you to get to your pumping space that they've accommodated for you. Okay. So the next one, is there a time limit for lactation breaks? Yes or no? 5 seconds. 15 minutes, no. Pretty much most are saying no, some are saying yes, some are saying that you get 15 minutes. All right, let's see. So the answer is no. You may take the time that you need for each break, as long as it is reasonable, right? If you are taking 90 minutes to pump, that may be considered unreasonable. You should see an IBCLC. We can talk through some things, but you may take the breaks as frequently as you need to express milk, and you are not limited to taking breaks during your normal break time. So I wanted to mention that. You also have the right to continue to express milk at work for as many years as you need after your child turns 1. Okay. So next question, can your employer refuse to accommodate you? Yes or no? Can they just say, no, legally no? Yes, yes, there are some yeses. All right, so the answer is, did I skip one? I did, so I'll go back. If you work for an employer with 50 or more employees, they must accommodate you. 50 or more, they must accommodate you. If you work for an employer that has less than 50 employees, they may deny you a private space to express your milk, but they have to prove that it is with it would include undue hardship on them. It would be unreasonable. It would hurt the business if they applied. And while they are doing that, they still must comply until the government has decided that they would grant this exemption, which is really, really hard. Okay, it's really hard for these instances for them to go through, but it is on them to prove that it was undue hardship. So let's go back to, can my employer treat me worse because I request lactation breaks? Yes or no? This is a bit of an easy one. Can they treat you worse? Right. No, 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 they cannot. It is illegal for your employer to discriminate or retaliate against you for breastfeeding, requesting to take lactation breaks, or having a medical condition related to lactation. Absolutely not. So let's see, we're on, okay. Do employers have to provide a space to pump breast milk, even if they don't have any nursing employees? What do you think? Yes or no? Seeing a lot of yeses. Do employers have to provide space to breast pump milk, even if they don't have any nursing employees? The answer is no. The law requires employers to provide a space for nursing employees each time such an employee has need to express milk. So this means that there doesn't need to be a permanent lactation space if there are no lactating or nursing employees. However, it is best practice for employers to consider where they would have a space available should someone need it. And in California, it is required to have a lactation accommodation policy. So this is something that they already need to be thinking about, but it does not need to be a permanent structure. And then lastly, can an employer demand a doctor's note or any other medical documentation if you want to pump at work? No, 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 no. Yes, consensus is no, and you are right. No, your employer cannot require you to submit any documentation regarding your need to express breast milk. Good job. All right. Thank you for playing. I don't have a name. Let's move on for this fun this fun game, but thank you. You guys are on it. So in the employee guide, there's also notes and tips and tricks on talking to your HR, your supervisor, about your lactation accommodation needs. So this was also one of the objectives. How do you even start that conversation? So the main takeaway is that don't be shy. Most employers want to meet the needs of their employees. They may need ideas on how they can best do that. And during pregnancy would be the ideal time to start that conversation. So if they do not have a permanent structure, they don't have a full-time lactation space, it can be ready and made available for you should you think that you are going to be providing breast milk or pumping at work when you come back from your baby bonding leave. So there's some sample language to get the conversation going that we have in that purple box. Like, it is very important for me to be a good employee and a good parent. My doctor recommends that I breastfeed my baby and help minimize the risk of illness. You can insert whatever your favorite breastfeeding benefit is. Your support will make it easier, and my needs are simple. And then you list your demands. But you don't need to remember all of your needs, right? This guide has it for you. So towards the end of the employee guide, there's actually a my lactation and work plan document that you can go over with your supervisor. And it includes the demands, right? It includes returning to work section that talks through the possibilities of returning with a flexible schedule, coming back part-time so your baby and you can adjust to being apart, and gives examples of what that may look like. It also discusses time. So your employer may have no idea what lactation accommodation even means. Am I going to have my employee gone for hours at a time? What's reasonable? And it kind of talks through that. So about every 2 to 3 hours at work for about 15 to 20 minutes each time, but that 15 and 20 minutes does not include the time it takes to get to that lactation area and to clean up and things like that. It goes over what a private space is and what that looks like, and that it needs to be near and what needs to be inside of it. And it gives examples of where that may be, some prompts to talk through that with your employer. And there's also a place at the bottom for your signature and your supervisor's signature, so you can say that you guys both went through that. I can't guarantee that they'll sign it, but it is there just to kind of solidify it. So how would you file a complaint if you feel like your rights are being violated? Where are you going to tell your clients, participants, and patients to go if they are not being accommodated? So simply put, as simple as it can be, there are different government agencies that enforce different parts of the law. And so to assert all of your rights, you may have to file a complaint with different divisions. So there is the Department of Fair Employment Housing, there's a Department of Labor, the Bureau of Field Enforcement. So this, I provided my slides. There's this slide specifically, which will help with that objective or where to go with these links. And you may want to start with a legal aid. You may want to give out the Legal Aid at Work's Work and Family Helpline. Just so that if you want to talk through with somebody, which law is being broken and where you want to file a complaint, or you could file a complaint with all of them, that may be a good resource. The 800-880-8047 number at the bottom. For the Labor of Commissions Office, that is the third paragraph. They would go in and do an investigation and inspection. And for every denied break or inadequate space, they would get, the employer gets a $100 fine. And that was pretty much kind of the enforcement, that the slap on the wrist that employers would get before the Pump Act, where you can sue them now. The guide goes on to provide other things such as the human milk storage guidelines from the CDC, what to do if you have extra milk. California has 2 nonprofit milk banks, Mother's Milk Bank in San Jose and UC Health Milk Bank in San Diego, that would love and be so grateful for extra milk. So it goes over details on that. It has a returning to work checklist at the end of the employee guide that talks about what to do during pregnancy. It talks about what to do during your baby leave. It talks about what to do a week before you go back to work. And it talks about what to do once you're at work. It's really comprehensive, and it's a nice little checklist that somebody can print out. And it also provides a sample feeding and pumping schedule, tips on preparing your baby for when you return to work, how to maintain your milk supply once you return to work, and just some basics of breastfeeding. It is a really comprehensive guide. I'm very excited that we finally got it done. We're premiering it here with you guys. There's been no other official announcement of it being alive and ready and open to the public. So please use that link in the chat. We'll put it in again. You'll see it at the end of my slides, I believe, to access that. It was a labor, pun intended, of love and passion. So we really hope that you guys utilize this free resource. So the employer guide, I won't spend as much time on the employer guide because it goes into the nitty-gritty of what employers need to do. And a lot of it is the laws that we have covered. I wanted to share this specific screen grab though, because it also just makes a case for breastfeeding. I don't know if you've heard that, a business case for breastfeeding. It helps with employee recruitment. It helps with productivity. Employees take less sick time for themselves and for their babies. And it gives them a better public image of being a family-friendly employer, right? And it's the law. Throughout the guide, it just keeps reiterating that it is the law. That is why we named it the California Law Guide. All those are nice, but it's also something that they have to do. What I do want to share and go into a little bit more detail of is these space solutions that we have in the guide. I'm really excited about these because, again, when people are thinking about, I don't work in a traditional space, how would I make it work in hospitality, in agriculture, in manufacturing? How would we make it work? So this guide has different bullet points of ideas on how you would make it work. And then some of these have actual pictures. So some of them are stock images. We would love for people to send us pictures of different spaces. Even if you see them here, we would love to get different angles or different ways that people are accommodating employees at different spaces. So please send them our way. You do not need to be in the picture. Nobody needs to be in the picture. It could just be of the space, just so that we have ideas. So when somebody does come up saying it's unreasonable for me to provide lactation accommodation for farm workers, we can have a bunch of pictures that show that that is just not the case, and other employers who are making it work. So there's education, there is agricultural. I have my own slide for that one. There's hospitality, manufacturing. We have restaurants, retail. The guide also goes into how big does the space even have to be? I do remember that it's 4 by 5. And how much does it cost? So it goes over what that may look like. And a lot of the time it's nothing. So take retail, for example. They have a dressing room, which you already have. It already has a place for somebody to sit. There potentially may even be an outlet in there. You would just need a table for them to put their pump on. And it needs to be close to some sort of refrigeration and running water so the employee can wash their supplies. So it had small businesses, what to do if you are in transportation. So there's also just this funny little space where sometimes there's just a space that you can convert with a partition or something where it is not accessible to the public and without intrusion. But it talks through and gives ideas. So lactation accommodation for farm workers. So I wanted to give some examples and have some pictures of this. So your employer must provide you with a private, enclosed, and shaded space, such as an air-conditioned cab or the truck or of a tractor or a tractor. This is also some options, a portable pop-up area. So you can see with the Washington National Guard picture, it's a pop-up tent space. That cooler, it would be an employer provided cooler, would act as refrigeration, and you could use that human milk storage guidelines to see how long human milk would stay fresh in there, and that would accommodate for a work day. Has the chair. There are portable battery packs, chargers that could be used for electricity in that space. But it doesn't need to be super fancy. You can make it work. There's really not many excuses, right? So a couple more scenarios that we can talk through a little bit. So this is Angela. She's an immigration attorney in San Francisco. So I'm going to read this space and you can think about what we've covered and what rights are not being accommodated and potentially where she could go for support or what needs to change. So if I had court at 8:30 a.m., I would plan to be in the city all day. That meant I had to figure out a way to pump multiple times so I wouldn't get mastitis, which I had before. The first few times I tried to haul all my gear through the courthouse, which meant I had to go through multiple security checkpoints. Like the airport, they have you take off your shoes, they scan you, they're touching your underwear and your bra and buzzing you down. Each time they had to search through my pump gear and inspect everything. One judge had worked with me while I was pregnant and one day asked, "How's it going?" There was no dedicated pumping space in the courthouse, so I was very honest with her. I said, "It's actually not going well." She offered to let me use her courtroom, which was incredibly nice of her. But it was short-lived because I'd often be interrupted by people walking into the courtroom. Because I'm an immigration attorney, I witnessed this problem for other pumping moms as well. Most women had no choice but to bring their babies to court due to lack of accommodation there. I found a high-rise parking garage a few blocks away and pumped there. Women should not have the right to pump, should have the right to pump and breastfeed without so many hurdles. They deserve that right. So think about that. Type in the chat. What are some of the things that you're hearing? There's a lot, right? That wasn't accommodated. What are some of the things that stood out for you? I'm hearing that she had no private space, right? No private space that was free from intrusion. The parking garage, interruptions. And for a courthouse to pretty much probably at all times have somebody who's nursing to not have a dedicated space. Some of these courtrooms are old, but that's not an excuse, right? Nothing close by, that parking garage a few blocks away. That's right. And again, there was potentially not a conversation had with whoever her superior is, whoever she worried about mastitis, absolutely. That when she came back from maternity leave and wanted to pump milk, who should she have talked to, right? There was no plan. And then there's Danny, a social worker in Sonoma County. So she says, I'm a social worker and I make house calls in Sonoma County. In the main office at work, there is a dedicated lactation room, but I was the only one in need of it at the time. So the people whose cubicles were closest to that lactation room started using it as their own personal kitchen. The lactation room had a chair, a small sink, a microwave, and a small fridge to store things in. When I came back from work, I had to use the room for the first time. The entire thing was covered in at least 30 coffee mugs. Coffee, tea, their stored food. You couldn't put anything in the little mini fridge because people had Go-Gurt and snacks stuffed in there. It was foul. The chair was fake leather and was covered in milk stains. It looked as if other moms had dropped milk on the chair, then never cleaned it. It was disgusting. I complained and complained. Eventually, I took everything out of the room and put every single person's cup and all the other junk in the main kitchen. I made a laminated sign for the place and hand scrubbed the chair. What's bananas to me is that somebody would still use the fridge for their dedicated lactation space for their creamer. They even went so far to put it in a kid's sippy cup to hide it. If you want to be a breastfeeding and pumping ally, don't place your belongings or food in a pumping room. Keep that space sanitary for moms. What are you hearing in that one? You hear a lack of allies, right? Yeah, I've been there. I mean, yeah, people take advantage of the space. It's not free from intrusion. People are messy, not supportive, not cleaning up. I'm hearing several complaints going unacknowledged. It sounds like she asked for support. She asked for help. She was the one that was having to write the signs that say, this is a pumping room. She did not get the support she needed. Absolutely not. Absolutely not. And it was not a clean, safe environment either. That is required. So it sounds like they had a dedicated room. It almost sounds like the room was available for all year round. And it may sound nice, but it wasn't the employees, her coworkers, whoever she was complaining to not get that space cleaned, just was not supportive. It was not supportive. I think I have time for a couple more. So I also got some, my board members were so great and they sent me other case scenarios that they heard. So one was of a housekeeper who worked for a company. So they would go house to house cleaning and they never were given break times. They could not pump during their commute either because they carpooled. Does this sound familiar to anybody? Working for a company, they were scared to get in trouble with their boss. I feel like I hear that a lot, that people are afraid to ask for these rights for fear of retaliation. Or fear, it sounds like in a lot of cases also, fear from their colleagues, retaliation. There was also a supermarket parent who would pump in the break room, but it wasn't completely shielded and it wasn't free from intrusion. A health clinic where the front office registration person was not given adequate time, and the staff and admin accused her of abusing the system, saying that she wasn't actually pumping and she just wanted extra break time. It's interesting. I was not expecting when I did this call for case studies from my board members to get so many instances where the coworkers were not being supportive. There were no allies. Even if the employer, I often hear more stories about the employers. They were given a space next to a bathroom, but that space flooded regularly. That doesn't sound safe or clean. And then there was also one through a school district in LA where 2 TAs were not provided with accommodation. And they were just said no, that they would not be accommodated. And those parents said, well, somebody at WIC told me that my needs needed to be accommodated. If not, I could file a complaint. And then their needs were accommodated. So sometimes it's a gentle threat. Sometimes you can pull up that guide and say, these are my rights, or hand them the employee guide, something to point to. but it's about advocating and knowing that you cannot be retaliated against. Your patients, clients cannot be retaliated against. It needs to be a safe, clean space, and that there are a lot of laws supporting them. If it doesn't sound right, if it doesn't feel right, if this space is not working for you, the law is likely on your side, especially here in California. So what are you going to do with what you learned today? What information you learned today? While I was speaking, did someone you know come to mind? Is there a client, a patient, a friend, a family member that you can empower with the information that you learned today so that they could advocate for themselves, for the accommodations that they need to continue to provide milk for their baby? How about organizations? Did any companies come to mind while I was talking, that you can slide one of these employer guides under their door so that they can make lactation work in their environment, be this family-friendly place, you know, and it's the law. So I really hope that you guys access the resource. I think I saw on the comment that some folks were having some issues accessing the guides. I am here to help. You can email me if you're having trouble with that link and it's not working for you. That's my direct email. Social media scares me, but I do have a LinkedIn and a professional-ish personal Instagram account. So please follow me there. California Breastfeeding Coalition is not afraid of social media. We have an Instagram. I think she's even on Threads or Communication Person. Don't ask me what it is. I'm like a geriatric millennial. Anyway, we're on Facebook and LinkedIn. So please connect with us. That is our website. We have a brand new website. It is very pretty. It launched July 1st as well. Prior to that, it was more of a resource for our coalitions, right, to go and get things. It did have information on there about lactation accommodation, but we redid the whole thing. That information is still there, but we also have tons of resources specifically for parents. When you type in California and breastfeeding, we want to and are one of the first things that come up in Google. So we wanted to have information on there that was a best practice and something that parents could utilize. So there's a going back to work section, there is pumping, there is breastfeeding basics. So our website in and of itself is a great guide. I encourage you to go through that and click. And then also our law guides. The email that you put in does opt you in for our newsletter. You can unsubscribe at any time, but you don't also have to go to our website and subscribe to our newsletter. The law guides would do that for you. But I'm happy to answer as many questions as I can. Also noting that if I cannot, if it's a specific question about laws or eligibility, that you can email me and I promise you I will find the answer to your question. Thank you.
Thank you so much, Jasmine. I know some people were having issues with getting onto that link. It might be like they have like the ad blockers or some type of blocker on there, because I was able to access it. I know a few people on the chat said they were able to get in. So double check to see if you don't have like an ad blocker. Is that what they're called? Sometimes it blocks it. So just kind of double check by the link to unblock. I know that I've come across that sometimes where depending on where you're working, sometimes they put that extra security, your employer does. So double check. And then, like I said, reach out if you're still having issues accessing the guides.
Yes, I will give you the guides if for whatever reason, potentially if you tried it on not a work computer, if you're at a work computer, but yes, if you are having trouble, Jasmine at californiabreastfeeding.org, email me and I will be happy to just give you those guides.
And we are planning on sharing this recording along with some of these resources. So that'll be coming in the next week. So anybody that registers, so I know we had some people that might have not been able to make it in today. So they'll all get the recording. So Jasmine, thank you so much for such a wonderful presentation. Before we move on to the Q&As, I did want to take some time to acknowledge Helen. Helen, if you want to come up here. Helen's from the David Valadeo, our U.S. representative here in our district, and she's here on behalf of David Valadeo, and he's voted yes on that federal pump act that you just talked about. So she's here in person. For those of you that are on Zoom, we did have like a little viewing party for our coalition members, And so we're all listening in a room here, and Helen was able to tour our WIC office here in Kings County. She's here attending this presentation, and we just really wanted to extend the gratitude that David Valadeo did support our WIC families, our community members here, and how important it was for him to, pass the bill and support us. So on behalf, I don't know if we could share you here. Let me see if I'm able to kind of just give her a quick little, let me see. I think it's, give me just a second. I'm going to remove the spotlight from you just a bit, okay? Jasmine, and then we'll put the spotlight back on you.
Me. Yeah, let's celebrate. I mentioned that.
Here we go. All right, come on over. This is Helen. Helen, if you'd like to share some words on behalf of David Valadeo.
Yeah, well, it's wonderful to be part of this. You all do such important work. So the congressman definitely supports this and was happy to vote for the Pump Act. This is just very important protections for mothers and new mothers, and we're happy to support it. So thank you all very much.
Thank you, Helen. And then also another important ally, I would like Karen. Karen, if you could come up and say a few words. Karen is from the California WIC Association, and she made the trip from Sacramento. And I want to give her a few minutes and how her work also supports working families. So come on in. So I'll give the floor now to Karen.
Hi, everyone. Thanks for letting me join you here today. It was really great to tour the Hanford WIC office and be here with the coalitions. And I just want to give a huge shout out to the coalitions, the local coalition and the California Breastfeeding Coalition, because of the leadership that everybody provides across the continuum of care for lactation accommodation, but also hospitals and in health centers and workplace and private practice, wherever families go. So I just want to give a big shout out to everybody and thanks for decades and decades of advocacy on the ground with local policies and practices and cultural acceptances and state and federal. So it really is all about locking arms with each other and all of our partners in academia and research and government and private practice. So California WIC Association, some of you aren't from WIC, is the state WIC association for the 84 WIC agencies that serve the California WIC program. And we support the work of the California WIC program. We're just very proud of our state staff and local agency staff who have worked tirelessly for 50 years next year, 2024, but have really experienced a lot the last 3 years with the pandemic and also the infant feeding crisis, which was really a double crisis for WIC because WIC contracts to formula companies, which made the crisis even more challenging. And through all that, WIC has modernized in many, many ways and is really helping turn around the participation that everybody saw starting to slag, about 10 years ago. And now with all the stresses that are in families, just really there trying to include all families and making sure everybody gets a healthy bag of groceries and lots of nutrition and lactation support each month and all the other great things you get as a young parent and young family starting off. So just want to say thanks to everybody.
Thank you, Karen. Thank you, everyone. And we are looking at, I know you have some questions about the QR code. I will go ahead and put that QR code back once we get through the Q&As. And what's going to happen is you won't get the link for the survey today. We will get that out to you by the end of the week. We have to confirm. So when you're on Zoom, it'll record that you were on there. That's what we wanted you to make sure your name's on there. Once we confirm that you did attend, then we will individually email you the survey. So the survey for the CE doesn't go out to everybody that registered. It's only those that actually logged in and listened live. Unfortunately, we're not able to provide a CE for recordings at this time. So no worries. At the end of the Q&As, we have a couple of questions for Jasmine. I will provide that QR code, but there's two ways we're going to use that QR code. So you've kind of logged into that one, but we also use the Zoom login. So we'll also review the Zoom list and make sure if you didn't get a chance to get the QR code, if you're on our Zoom list, you will get the link to the survey and you'll get your CE credit. So hopefully that might have answered some of your questions. All right, did you have, I'm going to go ahead and now pass it over to Liz, and she's from Tulare County, WIC, and she's going to then ask questions for Jasmine. She has a couple there. Okay, go ahead.
Hello, everyone. So I just have two easy, soft questions for you. But Kathy was just wondering, is this guide available to order, or are we to just print our own copies as we need them?
You can print your own copies as you need them. They are a free resource. That link will send them to your email, and you can download them and use them as you need. If you want to adapt them, I think we would want to ask for credit for that. You can come to us, but you can use them as is for however long you want.
Perfect. And then a similar question, Anna was asking if this guide is available in different languages.
It's not yet, but we want it to be. Yes. So that is also going to help when we get emails and figure out who is downloading it. It's also going to help us figure out if there's a big influx of people from, say, Tulare, Kings County downloading it, we can reach out to somebody and being like, is this guide working for you? Is there a specific industry that you would like this guide tailored for? Should we do a whole guide, or at least have a bigger section that talks about how to accommodate for farm workers or agricultural workers? So yes, we want to at least start with Spanish and probably Cantonese. And so we are in the works, but as of right now, it is just in English.
Okay. And then I think our last question would be, are you willing to share this presentation for others to use, giving you credit, of course? Like if we wanted to link this recording to other people who were not registered, you're okay with that?
Yes.
Yes. Thank you. Yeah. So those that did register, we will give you a link, and then you're welcome to share that link with others. You can always email the coalition so we can get you on our mailing list. And by getting on our mailing list, you'll be able to get invites for future lunch and learns with different topics. Part of the survey will also, get maybe some feedback from you, what other topics you'd like for us to bring. And these are quarterly here, but now we do have some time, Jasmine, if you're okay, maybe somebody wants to unmute and ask a question. If you would like to raise your hand, we could call on you, you could unmute. And if Jasmine, are you okay if you take a couple questions, maybe live? They're not in the chat.
Yeah.
All right. So if anybody has any questions for Jasmine, feel free to unmute, and she's available. And I'm sure sometimes these questions come up after, right? After we kind of soak in the information.
Email me for sure.
So she's opening up her email to us. So even if you don't have any questions for us right now, like I said, a lot of times we soak in this information, or as we're working with our families, it might come up. So Jasmine is available.
Yep. And I can also just give a quick plug. We can have a save the date for our annual breastfeeding summit. It's going to be 100% virtual. So it's January 23rd through the 25th, and we will be having a topic on lactation accommodation there as well. Some two people are talking about how they're making it work at their workplace, and we'll have an actual attorney, somebody with very cool legal initials after their name, coming also and giving a similar presentation.
Awesome. Thank you, Jasmine. That's great. Okay, I don't see anybody out there, but again, I know that we sometimes need some time to kind of soak that information in, but so much great information, Jasmine. On behalf of the Tulare and Kings Breastfeeding Coalition, we thank you for taking the time to share this information. And we're so excited that we're the first ones to see this new guide.
World premiere,
we are excited. And so like I said, pretty soon by the end of the week, we'll get this recording out. And then we just want everybody that attended today, just share it out there, share it with your families, but also employees. So employers, I should say employers, because they'll find that very helpful as well. Well, thank you so much. And you guys all have a great rest of your day. Thank you. Bye-bye.